welcome to my channel. Today's discussion will be the continuation of hernia. So if you've not watched that of part 1, you can pause the video here and start from there. Let's continue. To throw more light on people at high risk of hernia, we can talk about people having history of hernia, and it can be of different angle. It can be that they inherited it from their family members genetically, or they themselves, they've had such case before, and due to one or two things, it can be that through injury or through lifting of heavy load, it has caused its occurrences. So currently they've had it again, or because they've already proved that they have some weaknesses in any part of their body, being it the abdomen or their inguinal canal or any other place, they can even have another occurring of hernia in any part of their body. So take note of them. So if you've had surgery or treatment before, please, your chances of having another is high, so you have to take it in account. And old age, people who are old, as I said it earlier in the first video, they have atrophies, so their chances of having hernia is high. And even babies or infants, it can be that they have malformation, or there is non-closure of any of the canals, or there is an opening which couldn't close, so they can be a paveway for the protruding of any of their internal organs, and it will cause hernia. And people having chronic cough, if you cough more or chronically, you have coughing impulses, that can also cause hernia. And chronic constipation, it can also cause hernia. And we can talk about people who smoke. Smoking can increase your chances of having hernia, so take note of it. And pregnancy, I even said this also in the first video, pregnancy can cause those umbilical or the para-umbilical around your umbilicus or supra at the top of your umbilicus. It can cause it hernia. And weakness in any part of your abdomen, if you have weakness, you can have hernia. Your chances of having is high. And in female too, the internal femoral ring, if it is enlarged, that one too can cause hernia, femoral hernia, as I said it. And people who have had scars, like operation scar, if you have incision at any part of your body, it's easy for any organ to protrude because there is weak, and there can be hernia. Injuries can cause hernia. Weight loss, if you lost too much weight, it can cause hernia. And if you are also obese, you can also cause hernia. So in all things, it shouldn't be too much. So take note of all these to prevent yourself from having, or your chances of having, hernia. Let's talk about signs and symptoms which can be noticed in case there is hernia. In case there is hernia, there can be visible lump as a result of the bulging or the protrusion of the organ at the location of the hernia. And in terms you are coughing, whilst coughing, it will enlarge, like there will be enlargement of the bulging or the lump. And the moment you stop coughing, it will reduce, so take note. But in terms of people who are too fat or the obese people, it's not easy to notice, but still, if you are observant, you have to at least have some changes or see some changes at that location. Because of the excess fat or the accumulation of fat, it will be covering the bulging. But yes, so if you are observant, you can notice, as I said it. And there can be heavy descendants around the gut, so take note of it. And there can be pain, like there will be aching pain in terms of any exertion or physical activities. The pain won't be all that severe, but in case there is severe pain, then there is a complication, so you have to take note. You have to rush, don't even wait for that to occur, because during that severe pain is as a result of strangulation, or there is incarceration of the hernia. It is compressing those neighboring organ innervations, those arteries and nerves supplying nutrients to the organs, and it can cause necrosis or cell death. So take notes and don't waste time. And the skin color, it won't change. Like the skin color covering that bulging as well, it will be the normal skin color as well. So take note of all this. Let's talk about treatment of hernia. In terms of treatment of hernia, based upon the definition I said, that it is a surgical disease, and for that matter it will be treated surgically. So depending upon your severity and about discussion between you and your doctor, he will adopt a perfect surgery for your treatment, being it invasive or mini invasive. The surgery will be done perfectly. But people are having other concepts about the treatment. They said they can give you medication which will melt the bulging or the protrusion. And talking about the concept of hernia, as I said it earlier, I said it is your any part of your body which has been weakened. It can be your abdominal wall which has been weakened, and it has paved way for what protrusion of any of your inner organs. So the inner organs or the hernia contents can be your intestine, your small intestines, which normally it is. It can also be your stomach. It can be your ovary. It can be your urinary bladder or the tank of your urine. So supposing any of them, let's say your ovary, which is being bulging, and we've given you a medication which will be melting that ovary. Just think of it. So melting your ovary, after it's, then what are you going to use to produce ovum or produce egg for fertilization? Yes, just think about it. And even supposing is not that one, it's not your ovary but it's your stomach, it also has function. So if you melt your stomach, what are you going to use? So at the end you have to decide of the type of treatment which you would like to undergo. And even under surgery, what goes on is we will just push the organ which has protruded from its dislocation to its normal placement, and we will then face that weakness, that weak point. We will face it tight to the extent that if there is any dislocation, there will not be bulging, but it will push to its normal location. So take them in consideration and choose the perfect type of treatment you would like to undergo. And in terms of prevention, you should know all the risk. If you smoke, you have to put a stop to smoking. Don't be having too heavy exercise, especially those who have had surgery before. You've had incision at any point of your body, so you won't have it as at first. So take note and don't be lifting too heavy weights. And those who go to gym, if you are having your gym, you'll be lifting, so put on maybe a belt to help reduce the gravity of the weight. And in terms of feeding yourself too, you shouldn't be eating food which will be causing constipation. Taking much water, fruits, vegetables, any raw veggies, that will help you to prevent any occurring of hernia. Thanks for watching. Share, like, comment, subscribe, and suggest any medical condition.